this is the procedure. This is how the patient usually is looking after such a procedure, which is combining fractional with the ablative lasers. Yes. Just a minute, because I cannot hear you. This is the same laser with 20 microns ablation, but single spot, so that I can just go and touch the areas which were not covered between one spot of scanner and another spot of scanner. If the patient moves or your hand is not adjusting the pulses beside each other, you will see some gaps. So we just go at the end and retouch those areas with a single spot. It's the same parameters. Yes. Cooling device. Yeah, sometimes we are using the cold air cooling in order to decrease the pain. Of course, we can use it, but not a contact cooling. Usually after such a procedure, I don't want to put ice packs. The skin is sterile and it's open, so I should not touch the skin. I just apply something like the Mibu, which is going to do a good sealing and promote the healing, and that's it.
Can we apply some sunscreen over the Mibu? Because many times
No.
procedures are done in the daytime.
No need. I mean the short exposure till she goes home is not going to be an issue, and sunscreen is not preferred on an open skin, right? So you start the sunscreen and the bleaching agent after the complete healing. After the complete healing, whether it happens after 3 days or 1 week after the complete healing.
That means till 1 week she has to be in the house or something?
Even if the patient is in an office or at home with white fluorescent light, the sunblock has to be applied. The sunblock will be effective only for 2 hours. After 2-3 hours, as if there is nothing on the skin. So it has to be reapplied. And the SPF has to be more than 30. In order to have effective sunblock, the SPF has to be above 30. It has to be reapplied after 2-3 hours, and it has to be applied indoors if the patient is staying in fluorescent light. Okay? If the patient is under Roaccutane, this treatment is not, of course, recommended. We should not use such aggressive treatment of the skin under the Roaccutane treatment. We prefer to have 3 to 6 months after stopping the oral retinoids. The other thing, if the patient is having recurrent herpes simplex virus, then protection 2 days and 2 days 2 days before and 2 days after the procedure are very antiviral. It's not an issue. It's not a problem.
Sir, what about the result regarding stretch mark with this case?
It's good. Stretch marks still is something which is very challenging, but the improvement we saw is significantly better than other options we have. We are using the fractional laser with level 1 or 2 coagulation according to the skin, and with 75 to 100 microns of ablation, and we're getting very good results. But still we don't advise or we don't promise the patient improvement more than 50%.
And what about the result? Like razors, stretch lines are with the little bleeding and atrophy. Any difference in the result?
Between what?
Immediate, like postpartum scars and after some of them will be like little razor ones. Any?
No, this is more for old scars. If it is erythematous and red, this needs a pulse dilator. But when it is old, then the roll will be there.
How many sessions she needs?
How many sessions? Usually you do 1 session and wait for 6 months, because the collagen will keep improving for 6 to 8 months. And after 8 months, reevaluate if you need to repeat a session of this or you need to do something different. But usually from 1 to 3 sessions. This is what we tell the patient. Of fractional lasers from 1 to 3, especially the ablative fraction. And of course it will depend how aggressive you are. You can go more aggressive and then definitely it's 1 session. You can go less aggressive and do 3 sessions. So it will depend on the settings.
About the frequency of application of the Mibu
Yeah.
daily.
4 or 5 times. 4 or 5 times. The objective.
Washing and
Yes, washing and then reapplication. Just water. Water is enough. The objective here of the Mibu is 2 things: to keep the moisture of the skin to avoid scab formation. Number two is to promote the healing.